Good morning, I'm Dr. Manohar. I'm going to talk on the carpal tunnel syndrome, followed by the pronator syndrome. This picture depicts the carpal tunnel, the location of the carpal tunnel, which overlies zone 4 of the flexor tendon zones. The boundaries of the carpal tunnel is made up by the scaphoid tubercle and the trapezium radially, hook of hamate and pisiform ulnarly. The transverse carpal ligament forms the roof, and the proximal carpal row forms the floor. There are many causes of carpal tunnel syndrome. These include trauma, for example, in lunate dislocation. The lunate compresses the median nerve. In hypothyroidism, due to mixed edema. In rheumatoid arthritis, due to compression of the median nerve by the synovial tissue. In pregnancy, due to fluid retention. Cyst or tumor in the canal may compress the nerve. And most of the time, there is no cause that can be found. The symptoms include numbness and tingling in radial 3.5 digits, clumsiness, patient easily drops objects, and there is early morning awakening due to pain and paresthesia. The patient can be asked to perform the self-administered Katz and Stirrat hand diagram, and is supposed to be specific for carpal tunnel syndrome. This is the diagram, the Katz and Stirrat hand diagram. So patient will draw and mark out the areas where there is numbness, as well as the radiation of the pain proximal to the wrist. On clinical examination, we should look for wasting of the thenar muscle, check for the sensation over the radial 3.5 digits, Tinel sign, Phelan's test, Durkin's test, test the power of the abductor pollicis brevis, and check for the sensation over the palmar triangle. Here you can see there is a wasting of the thenar muscle, and when you check the sensation, look for the sensation over the radial 3.5 digits, as well as the area over the supplied by the palmar-cutaneous branch of the median nerve, which forms the palmar triangle. And you should perform the Tinel sign. It is considered positive when the patient experiences electric shock-like sensation when you tap just around the wrist crease. Next is the Phelan test, whereby patients are asked to flex the wrist, and within about 30 seconds, patient will start experiencing numbness in the radial 3.5 digits. The other test is commonly done is the Durkin's test, where you apply pressure directly onto the median nerve, and patient will experience the symptoms numbness over the radial 3.5 digits. Next is the thumb abduction to check for abductor pollicis brevis. Investigations done for carpal tunnel syndrome include nerve conduction studies, and the sensory fibers are more sensitive to compression than the motor fibers. So this nerve conduction is commonly done. But once you've made the clinical diagnosis, you have no doubt there is wasting. Don't waste your time doing the nerve conduction studies. Just proceed with the carpal tunnel release, unless you have problematic patient whom you think may be having some workman's compensation. Then it is good to document this by doing the nerve conduction studies. Conservative treatment includes splinting using the carpal tunnel splint. It should be worn for 23 hours in a day. It may be difficult initially, but once patient gets used to it, they should be able to maintain it for 23 hours in a day. Then vitamin B6, B1, B6, B12 supplements, anti-inflammatory drugs, steroids, and steroid injections. These all will claim to help the as part of the conservative treatment to reduce the numbness experienced by the patient. The more definitive treatment is the surgical treatment. There are two ways of doing this. You can do an open release or you can do an endoscopic release. So there's always a question in the mind, which one is better? Of course, endoscopic is very simple, a very small incision. You don't do the conventional big incision for the open carpal tunnel release. And the outcome is the same, except for the initial part. Because of the small wound, the recovery is a bit faster. However, there is a very steep learning curve to be able to do this endoscopic carpal tunnel release, and there can be complications with injuries to the nerves or the tendon.